Hello, everyone. My name is Marisol Dominguez, and I will be presenting my quality management project on catheter-associated urinary tract infections, also known as Cautis, in relation to the Plan, Do, Study, Act model. The issue, the problem. According to the Joint Commission, Cauti is the most frequent type of healthcare-associated infections, and it represents as much as 80% of healthcare-associated infections in hospitals. Between 15 to 25% of hospitalized patients receive urinary catheters during their hospital stay, which means that this will increase their chance of getting a UTI related to them having a Foley catheter. Catheter-associated UTIs. Cautis have been associated with increased morbidity, mortality, healthcare costs, and length of stay. There are approximately 13,000 Cauti-related deaths each year, with related costs upwards of $500 million annually. And this information was provided by the CDC. In addition to that, hospitals are losing money because a lot of the insurance companies, Medicare and Medi-Cal, they don't want to pay for the services that are provided to patients that acquire a UTI related to their of having a Foley catheter. So hospitals are losing money. They're not getting reimbursed for the associated treatment costs to treat the infection. Having a urinary catheter causes patients inflammation to the urethra and bladder neck, which causes patients to have a harder time to fight an infection. Issue identification. Some of the risk factors associated with Cautis include inappropriate use of indwelling catheters, such as a substitute for nursing care and also for patients that are incontinent, staff not using aseptic technique and failing to follow hospital hand hygiene guidelines, leaving the catheter longer than necessary. In fact, last time I was reading an educational pamphlet on Foley catheter insertion at our hospital, and it actually stated that if a patient sees that the nurse or healthcare provider who's going to place their Foley catheter does not wash their hands before the insertion, that it is very important that them as a patient take the initiative to tell them, go and wash your hands. And hand hygiene is very important because it actually helps reduce infection rates in hospitals, because as healthcare providers and we touch different surfaces where bacteria is, so hand hygiene is very important. Issue identifications. What can RNs do to reduce Cautis? At our hospital, I was actually able to find a Cauti prevention bundle, which are some of the things that nurses and anyone who is inserting a catheter can do in order to prevent Cautis on patients. And these prevention bundle guidelines were developed using evidence-based practice. So it is important, like I stated before, for the nurse or for the healthcare provider who is going to insert this catheter to perform hand hygiene before and after the insertion. It is also important that they use aseptic technique. So it is very important that everything is kept sterile. Also, it is important to assess optimal catheter site selection. In fact, I was reading that it's actually better to use a smaller catheter that will drain everything. It is also important that to document the indications for catheter insertion. So many times patients are getting catheters inserted for no good reason. So it's very important that the indications are actually good, like if it's related to an obstruction, to retention, that it is in place because it is due to a urinary retention. It is important to document the date and time of catheter insertion and the date and time of removal. I've actually seen that a lot of nurses do not document this, and this actually affects the data collection, because if you think about it, if no one documents the date that it was inserted, then how are we going to know how many days this patient has had the catheter for? It is also important that we document assessment of catheters daily. It's very important to assess catheters. Sometimes catheters don't drain well, and one of the reasons that happens is because sometimes these catheters can also be placed due to hematuria. Some patients come to our special procedures areas because they have blood clots. So doctors do a blood evacuation on these patients to remove all the clots. But yet sometimes there are still clots, and these clots actually cause an obstruction on the catheters that it's very hard for the urine to drain because of the clots that are there. So that's why it's important that we assess the catheters. I remember that last time I had a patient who did have an obstruction, who had a clot that was obstructing and affecting the drainage, and it helped to irrigate the catheter. And that way, all the urine came out. And this actually helps reduce the chance of that patient getting an infection. Uh, Also, it is very important to follow catheter management strategies. It is also very important that staff receive training and education to ensure compliance with recognized Cauti prevention policies and procedures. It is not only important to educate staff, but it is also important to educate patients of things they can do in order to prevent a Cauti, especially if they're going to go home with a Foley catheter in place. What are some of the signs and symptoms of a Cauti? Some of the signs and symptoms of a Cauti include fever, chills, pain, changes in urine consistency, color, odor, opacity, and increased sediment. In the more vulnerable geriatric population, in older patients, cognitive changes happen. Lethargy, anorexia, and more generalized symptoms can be associated with UTI, while in younger patients, these may be considered atypical symptoms. So it does happen that there are patients that go home sometimes with a Foley catheter, and they're older. So many times they don't tell their loved ones, "Oh, I'm having these symptoms," or my suprapubic area hurts. I feel like I'm retaining urine. They don't tell them. So these patients, when they start to develop UTIs, a lot of times what their family members have told us is that they start to develop cognitive changes and lethargy. Quality variance, quality improvement. It is important to identify strategies that are being implemented in order to reduce Cautis. Cauti prevention strategies need to be changed. When things are not working, we have to develop new strategies. And I think one of the best ways to develop strategies is by bringing nurses to the table, having the input of other nurses of what things can be changed and what can be done in order to reduce the Cauti recurrence, so less patients can get them. It is very important to hear from them because they're the ones that will know what is the root cause, what caused that patient to develop the Cauti. One of the things from reading the policy at our hospital, I read that it is very important that nurses report data to epidemiology department because that will help keep track of the progress that has been made to reduce Cautis. It is also important to keep track of the standardized infection ratio. The higher the standardized infection ratio, the more changes need to be made. It is also important that collecting data and reporting all identified cases to the Infection Control Committee and the state via the National Health Safety Network website. Root cause analysis, define the problem. Cauti still continues to be on the rise. Some of the causes are leaving the urinary catheter longer than indicated. The catheter may become contaminated upon insertion. The drainage bag may not be empty as often. And bacteria from a bowel movement may get on the catheter, urine in the catheter bag may flow backward into the bladder. That's why it's very important that the bag is below the bladder, so that way the urine can flow good with gravity. Gravity helps. It's also important that the perineal area is clean. And the other reason that patients develop Cautis is also because the catheter may not be regularly clean. Scope of the problem: some of the stakeholders that are affected by this problem are the hospitals, facilities, the insurance, the Medicare reimbursement, also patients that come into the hospital who didn't have a UTI before, and when they get it, they have to suffer from the symptoms that they get, and I'm sure it's very uncomfortable for them. Solutions: it is very important to consider other alternative options that patients have, such as a bedside commode, urinal incontinence garments for both sexes, and external condom catheter for males, bladder scanner to confirm that the patient is retaining urine, and also use a we can also use the straight catheters, intermittent catheterization. And it is, like I said before, it is very important that we engage patients and family members, that we educate them about ways they can prevent urinary tract infections. It is also very important for us to teach them the importance of recognizing the signs and symptoms of an infection. Nurses and physicians should be aware of the indications for urinary catheter use and should continually monitor for the patient's ongoing need for a catheter. As nurses, we are the patient's advocates. Therefore, it's very important that if we see that the patient is improving and that he no longer needs a Foley catheter, that we notify the healthcare provider so that way he can put orders for the catheter to be discontinued. One of the articles that I was reading, it actually talked about a hospital that developed certain programs in order to reduce the catheter-associated urinary tract infections. And some of the things that this hospital did is that they created Cauti ambassadors. So registered nurses took classes and they learned more about how to prevent catheter-associated urinary tract infections. They also learn insertion techniques with return demonstration. And in addition, they receive instruction about perineal care, how to maintain a drainage bag, and the concept of using a stat lock for proper securement. It's always very important because if we don't use a stat lock, then the catheter retracts, and it hurts the patient because it applies pressure to the urethra. Also, they develop a Cauti algorithm. They also educate Cauti ambassadors and staff on best practice in insertion, like I said, and maintenance guidelines. In fact, they say that it's better when two registered nurses are the ones that insert the catheter, because that helps maintain aseptic technique. And this is actually true because as a nurse that works for the urology clinic, I've noticed that there are sometimes when you need two nurses there, especially for females. Sometimes it can be hard to find the urethra, and in order to not contaminate the sterile field, it is important to have another nurse so they can bring a flashlight or turn on the light, a brighter light, so we can visualize the urethra, find it, because sometimes the reality is that for females, there are certain females that do have a more difficult anatomy, and it can be more difficult to identify the urethra, or sometimes patients with cognitive development problems where they move a lot, so it is important to have someone else to assist. Also, it is important to do Cauti rounds interprofessional rounds on all patients with indwelling urinary catheters in real time to discuss catheter status, opportunities for removal, and learning opportunities. And one of the great things that I like about the hospital that did this study is that they actually include the doctors too. So it says that's why it's called interprofessional rounds. It's not only the nurses, but also the doctors, because we have to work as a team, nurses and doctors, in order to promote quality care and to reduce the catheter-associated urinary tract infections. Cauti Kickoff, educational program for hospital physicians, advanced practice providers, nursing leadership, and staff to address Cauti best practice standards. So, like I said, teamwork is very important, and it's important to include everyone. Education of supportive staff, patient care assistants, technicians, physical therapists, and patient transporters educated on best practices, maintenance guidelines, root cause committee, monthly analysis and evaluation of every Cauti case to identify opportunities for improvement. And one of the things that I like about this root cause committee is that they do a meeting and they're non-judgmental. They do it in a very non-threatening way, so that way staff can open about these patients and what caused them to get a Cauti, and this will actually help improve things. It will help to identify the root cause, so that way a solution can be brought up. Solution implications. Some of the solutions to prevent Cautis include identifying when a catheter can be removed, and if you see that there is a need for the doctor to order for that catheter to be discontinued and that the patient no longer needs it, then it is important to call them. It is also important to use aseptic insertion, very important in order to prevent UTI and from introducing bacteria into the bladder. Like I said, like it is, when you're inserting a catheter, they say that the patient, you're actually increasing the chances of the patient developing a UTI. Also, it's very important to do regular assessments of the catheter, making sure that the catheter is working properly, that it's draining, and that there's nothing that is blocking. It is also important for staff to be trained for catheter care. Evidence-based guidelines and Cauti prevention. Preventing unnecessary and improper placement, like I said before, is very important. Preventing catheter replacement, maintaining awareness and proper care of catheters, and promoting catheter removal. So we are the advocates. We are the ones that have to be telling the doctors, you know what, doctor, I feel that this patient no longer needs a catheter, and stating the reasons why. Analysis. It is important to collect data that measures the standardized infection ratio, incidence, and the number of days that the patient had the catheter for. A high standardized infection ratio indicates that there is room for improvement. It is also important to collect data on how much money the hospitals are losing due to these Cautis that the patients are acquiring during their hospital stay. So the hospital that I was talking about and all the implementations that they took in order to reduce the infection rates at their hospital, they collected data, and this data, as you can see, was collected for the ICU. And you can notice that once they started implementing certain changes, they actually were able to reduce the Cautis. So by the end of 2014, they were able to reduce the Cautis by 32% in NSUH, and they were able to reduce it to 22% in Northwell Health ICU. And also for June 30, 2015, you notice that their goal was to do a 50% reduction rate in Cautis, and they actually surpassed their goal, and they were able to reduce the Cauti incidence rates by 57% in the ICU area. So as you can see, some of the implementations that they made actually helped reduce the infection, the Cauti rates. Next steps. It is important to include the interprofessional team in order to meet the goals of reducing Cautis, as was seen in the study that was conducted for that hospital. They included the interprofessional teams, and they did see a dramatic reduction in the CAUTIs that their patients were acquiring during their hospital stay. It's also important to provide educational programs that are focused on care for patients with indwelling catheters. These educational programs can focus on perinatal care, maintenance, and insertion techniques. 2 RN mandate. It's always nice to have another RN be there when the catheter is inserted, especially for patients where that might be more difficult. It is also important to have CAUTI ambassadors, and providing nurses with knowledge. Education is a key. A standardized infection rate goal of less than 0.85 correlates with the CMS of 2015 threshold. And this is a list of my references. And thank you for watching my presentation.